Good afternoon and welcome to Heart with Dr. Nieca. And joining me today in a discussion on breast health is Beth Battaglino. Beth is CEO of Healthy Women, and she is also a maternal fetal nurse and a friend of mine. And I'm really excited, Beth, to have you on the show today.
Thank you, Dr. Goldberg. I love being on your programs, so thank you for having me.
It's great to have you here. So I want to start off so you can let our guests and listeners know about Women, how you started it, and what your goals are.
Oh, thank you. So Healthy Women, we are the leading national not-for-profit women's health organization, and we started solely to provide women, no matter what their socioeconomic background is, trusted, credible information, and more importantly, resources that they can go to find out more about their condition. We were a toll-free number, and then we created a newsletter, an 8-page newsletter that was a bi-monthly publication. And one of the things that always resonated so well with our consumer audience was that we always took the topics but created questions that women could ask their healthcare providers. So making the most out of their visit with their healthcare provider and then providing them with credible resources that they could use to get more information. And so as the website, as internet became more and more popular, we created an online destination for women. And in the late 90s, we launched the first women's health website called HealthyWomen.org. And now 30 years later, we're still in business and we're still that go-to source for credible information on women's health. And we address everything from head to toe. So if your consumers are, your audience is interested in anything that has to do with women's health, visit healthywomen.org.
And actually deals with health issues for women across the lifespan. And
it does. Yeah.
And important. But now you're working on something new. You're working on these consumer hubs that'll be part of the website that focus on important issues for women. And I invited you here today to talk about the new breast hub. It's interesting that we're discussing this on the last week of Heart Month, but I think it's very important as a cardiologist and internist that we talk about all aspects of women's health care, no matter what month it is.
I could not agree more. And yes, it is very funny that we're having this conversation in February, but you know, we created the breast hub. So we have, you know, so much information on breast health, but it lives in different areas within the site. And our goal with Healthy Women is to become, you know, that easy destination where you can find everything that you want in one click. And we're constantly changing the way we're serving and presenting our information because we listen to our audience. And I think that's what has made us so successful and kind of drove us to think about creating a hub within Healthy Women. So as we look at breast health, we look at all aspects from, you know, being diagnosed, like, you know, the importance of prevention. So mammograms, if you're diagnosed and are going to have surgery, what you can expect. And then even options, you know, so many women think about breast implants, reconstructive surgery. All that information is within that breast hub. And it's not just about being diagnosed and living with cancer. It's also healthy breasts and how breasts change and during breastfeeding, and everything that you need to know about breast health lives within this hub. And again, it's making it easier for our consumer to find what she needs when she's looking for it.
Well, you know, it is very challenging. And one of the things earlier today on Beyond the Heart on my Doctor Radio show, I spoke with a radiologist talking about breast imaging. And one of the things is that, you know, breast mammograms are recommended for women over 40 and over. And I said that it's a challenge because not all the organizations are on the same page when it comes to when you should get your first mammogram. So how did you guys handle that?
Well, you know, we always say talk to your healthcare provider, right? Because family history certainly plays a role in that. And if your healthcare provider says, you know what, Beth, you know, you have a high risk of, you know, your family history really denotes that you should get a mammogram at age 35 instead of waiting to 40. So it's making sure that consumers have that intel, that information on, how to bring that conversation up with your healthcare provider, the importance of your family history when you're talking to your healthcare provider about your overall health is so important. So yes, like we have that information on how to manage those types of conversations. And, with that approval from your healthcare provider, your insurance is going to cover it for the most part. And if it doesn't, then we provide some guidance on what you need to know.
I agree there, when there was a concern when there was such a, different organizations were not on the same page with when you should start mammography. To the credit, the insurance companies paid for the mammogram starting at 40. And I think that's very important because they realize this is a very important health issue for women.
It's a very scary, yes, it's a very, yes, I agree completely with what you're saying. And I actually remember that and that confusion, and we're still seeing some confusion, in different areas. And that there's another topic, but that can be for another show. So I think our role as healthy women, our role is to make sure consumers understand what the guidelines are, what the recommendations are, and the importance of your family history and your concerns, and how to bring that conversation together with their healthcare providers. So between your healthcare provider and you're making the best decisions for your health.
Right, and you also have, you talk about the different tests that are used for breast cancer.
Right, there's different tests, there's different types of mammogram machines, right? And then we're also talking about, if you're diagnosed, what you need to know. So, how to identify your team, questions to ask your healthcare provider. Also, the importance of interviewing different physicians to make sure that you have the right physician for you. Yes, you're diagnosed, but you can take time to breathe and figure out a plan that's going to be best for you. The importance of different organizations, making sure that we represent those organizations that have done such a great job in providing information on breast cancer, from the American Cancer Association to the Susan G. Komen Foundation to Bright Pink. There's so many different organizations that have done such a great job in making sure that consumers are aware of them, the support groups that they offer, and hearing from other women that are going through the same diagnosis and treatment is so important for healthy women. That's always been a strong pillar for us, is getting real women to share their stories so that other women know that they're not alone.
Now, you bring up a really important point about the healthcare team. And I want people to understand, people are used to like, I'm going to that doctor, but in fact, for a variety of healthcare issues, it's more or less a healthcare team. And, sometimes people aren't ready for that. And, you still see patients as well as being the CEO of Healthy Women. And I'm sure you hear this kind of feedback. And in particular, even in my own practice, if somebody gets a call from the nurse practitioner, I think they know the person who works with me because she's been working with me for a really long time. But instead, it's like, I don't want to talk to you. I want to talk to the doctor. And when I get the person in the office, I make a real effort to talk about the healthcare team. In fact, we had a patient this week who wasn't complaining about Colleen, the nurse practitioner with whom I work, but really another service that she was at NYU. And that was not handled well. And it's really interesting. When Colleen had been reading a lot of the messages the patient was sending me, so she asked me if she could come into the office with me when I saw the patient. If she could get to, I thought that was brilliant.
I think so. I think it's brilliant. I need to meet Colleen because she sounds amazing. And you always speak so fondly of her. But I agree, it's a whole education piece of it, right? Because for so long, it was just the doctor and patient. And now that with the continued shift and how we're managing patients today and the amount of patients, it really is a team. And I think, cancer, and I just remember when I had a family member that was at Sloan Kettering, how impressed I was with the way they were managing not only the patient, but the patient's family. And they created this whole, team of experts that were there, and you felt like they were just there for you, which I thought was so amazing. So you get the nurse navigator, you get your oncologist, you get your radiologist, but making sure that the patient understands their roles and how they will be working with you is so important. And even the pharmacist, because for so many patients, they're going to be on a whole new regimen. So making sure we understand what their insurance is, whether they're going to get their medications mailed to them, are they going to work with a specific drugstore, or a local pharmacist, making sure that we bring them into the conversation, because I feel like the more education and the over communication with the patient, the better it's going to be, to make them compliant and to make sure that we are taking the best care of that patient that we can.
And I think if you make it clear at the baseline and explain all the people ahead of time, you always do better. Another point I want to talk about with the information for the breast hub is, when people do go to meet with their doctor and their treatment plan, they may or may not need radiation therapy or chemotherapy. And it's important when a woman goes in for this consultation, they also share with the doctor their other medical issues, like if they have high blood pressure, if they have heart disease, if they have asthma, whatever it is that they have. And because right now we're learning that in terms of in the cardiology community, certainly breast cancer treatments and treatments for other cancers, like even lymphomas, can affect the cardiovascular system. It may not be immediate, but it's somebody who should be tracked for later on.
You bring up such a good point, and as we continue to build out the breast hub, you're absolutely right. Like cardiovascular health and breast and breast cancer need to go together. Like there's just so many different components that most people are not aware of. And the long-term complications from chemotherapy or radiation or a combination. So it is important. And as we continue to grow this breast hub, you're going to see those topics being infused along with the real women, real stories. So people sharing their journey. But I think it is so important. And it's just a new way that consumers can navigate our site where we're being as efficient and as effective as we can with the way that we're pulling together the information and making sure that she gets everything that she needs in one click versus 10 or 15 clicks to different sites.
Yeah, I mean, the 15 clicks is also too much to go through.
Right, you just leave, yeah.
An answer to a question. So when can people access the breast hub?
You know what? It's live right now, and we love your feedback too. So we definitely have evaluations on there. So if you visit our site at HealthyWomen.org, and there's a specific URL that I'm actually going to look up so I can make sure I'm sending them to the right place. It's I think it's your breast cancer. And now I gotta put on my glasses though. It's on. You can find it at HealthyWomen.org, but you can also visit why I have the site. YourHealthyBreast.org, YourHealthyBreast.org. And once you're on there, you're going to find a tremendous amount of information. And please know that we're going to continue adding and growing this hub. But it's a great resource for women. And we've listened to her. We've listened to healthcare providers. And what drove us to create this hub is just making sure that we can pull all the great information we have on breast health in one space, and that you can find it as quickly and get the answers that you need without having to shop around and spending excess time that many of us don't have these days.
And this morning I spoke with a breast radiologist, as I mentioned earlier, and she was talking about an interesting finding now that people are getting vaccinated. So women are, first of all, women haven't been scheduling their mammograms over the last year because they're concerned about safety factors due to COVID-19. And most, healthcare systems have been at the forefront in how to protect patients and their staph from infection. So she said, like, they've been seeing in some of the people who are vaccinated that on the same side, like, so if you have your vaccine, let's say in your left arm, and they do a mammogram, they see a swelling of the lymph nodes from the armpit that can be seen in a mammogram. So obviously seeing lymph nodes in a mammogram is a concerning finding if people haven't been vaccinated, because
Right.
concerned that cancer could have spread. But they're noticing this in people who have recently been vaccinated, because part of the immune response also occurs in the lymph nodes, and you're building the immune response to COVID-19 after the vaccine. So they're now recommending that if you need to schedule your mammogram because you're behind in getting it, you should do that 4 to 6 weeks after your second dose.
That's so great. And I'm so glad you brought that up, because that's something that, we'll make sure that we address on Healthy Women and get that out there because of the timeliness of it. So many people are now getting vaccinated, getting their second vaccination. So it's important for them to know that. And I'm just going to echo your sentiment here about the importance of getting your mammogram. There's no need to put it off. I feel, the same as you, that our hospital system and our practitioners are doing such a great job at making sure that things are safe in their offices, that people are taking in on time. So when you schedule your appointment, you're not waiting in the waiting room with 5 or 10 other people. You're taking in on time. The machines are clean. So if you put off getting your mammogram or any other preventative screening, please make that appointment and get it done. It's so important because we know mammograms save lives.
They do, and that is the first, people are going online and learning about all the different tests, like maybe the mammogram isn't enough, you need extra tests. I think you need to go with the first test.
Right.
Go from there,
Exactly.
It's not about collecting medical information, it's about targeting the medical test that you need.
I agree. I could not agree more.
I know that people do a lot of rating, and a lot of my patients come in and ask for a particular test. And then we talk about if we need to look for that because either the test has already been done or it doesn't need to be done in an asymptomatic person. That relates with different forms of heart testing, but I'm sure you see this in your work. I'm very interested in getting the latest test and how to sift through that.
Well, it is, knowledge is great, right? And so it's so amazing that, we're seeing so many news programs covering science and research and technology. And you're seeing, magazines, people that are still reading magazines are seeing articles covered and in the newspaper. And then for physicians like yourself and for, organizations such as mine, that's, speaking directly to the consumer, it's making sense out of these new innovations in science and research and testing, and making sure that they understand if the test is really required or if it's, if they need it, and or providing those questions so they can have that conversation with you or whoever their healthcare provider is to make the best decision. And I think, when I think about when I started in women's health, it really hasn't changed because you kept seeing new technology, new testing, and the importance of it, but it's just making sure that consumers understand it and it realize that like one size doesn't fit all. Like just because
Right.
this test is available doesn't mean that it's right for me. We need to understand, my background, my history, and whether or not, my healthcare provider feels like this is the right decision and I should be having that test.
Yeah, and one of the things that I am concerned about, which I know you're interested, is how do we get younger women to take better care of themselves?
Here's my answer on that. I think we do it through education, right? And we do it at a younger age. I think it's very hard to change when you're older, but if you start implementing healthier habits, and it begins, and I feel like it begins in like even nursery schools when they're very young. You just start talking about the importance of prevention, eating well. I mean, you and I have had conversations about diets and what we feel is the best diet. We've talked about the importance of exercise. And then I think, the importance of your annual wellness visit and preventative screenings, and like, how lucky are we to have preventative screenings available to us? I think about my, great grandmother and my grandmother, and even my, looking at my mom and the advancements that we've seen, since she was younger. It's amazing. So I do think there, we just need to continue to do the great education. And I think about the great program that you created that was an eye opener for me, was the Go Red program, because that, even heart health, like women didn't, it was always, I always felt like it was a man's disease, an older man that was overweight, never thinking that heart disease was the #1 killer of women. And now you basically changed that whole, curriculum on how, the importance of understanding your heart health, especially when it pertains to women. So I think, look at the changes that you've made, and I think we're continuing to do that. And but I do agree that I think it needs to start very young, and that it needs to be ongoing. We can't just stop it. Like, it needs to be ongoing.
And one of our listeners has a question. Dan writes, what are some healthy habits that young women should practice?
Young habits. Stay out of the sun is one that I'm
because you work in maternal fetal medicine.
Yeah. I think what I'm seeing right now, I think diet and exercise is really big. I think really making sure that you get exercise is so important for younger people, and that the importance of your diet is really important, because especially when I see pregnant women and postpartum. I think making sure that you manage your weight and eat healthy, because now you have a new little life, and that can be a whole new chapter. And especially if you're breastfeeding, the importance of what you're eating and how you're taking care of you is going to affect that baby.
They have to realize when they are breastfeeding, what you eat is going to be.
Right.
And, I think, as I saw, my niece had her baby last year, April 23rd, in the middle of the pandemic, and he's really growing up, and he crawls, and he's starting to pick up food himself. She feeds him, puts down food, and he's eating it. He looks like he really enjoys that. But she's putting out healthy food. At least she's only showing me the photos of the healthy food. But I think she's doing a good job. I also think that we have to make sure that young women who are smoking find an effective way to quit smoking.
Right.
Long-standing smokers develop not only increased risk for lung cancer, but there's problems with asthma and chronic lung disease. And it's really sad when we could have stopped this early and prevented some people from feeling so disabled when they get older because they don't have good lung function. Young women have to make regular doctor's visits. They see their OBGYN certainly after they have the baby. Women that you see, but one question that always comes up on Dr. Radio is the fact that if someone has high blood pressure during pregnancy, what's the follow-up? Because women are lost to follow-up.
You're absolutely right, and I think I would love for you to talk a little bit more about that, because we're not seeing that follow-up. We're not seeing that recommendation. And I think it's so important. And I told you we're going to do a show on that, because I think between gestational diabetes and then high blood pressure, and making sure that mom understands, yes, it's important to take that baby for their checkup a couple days after discharge, but it's also important for you to go back to your OBGYN, as well as your primary healthcare provider, and let your primary healthcare provider know that your blood pressure was high during your pregnancy, because I think those conversations are being missed.
Yeah. So, and to sum it up for Anne's great question, we think a lot of healthy habits that young women should adapt is a healthy diet, and pretty much I'm a big advocate for the Mediterranean style diet, because it has good nutrients from all food groups. healthy fats, olive oil, canola oil, omega-3 fats from fish, low in meats and sweets. We know that the diet goes a long way in reducing risk for heart disease, lowering blood sugar, and lowering blood pressure and cholesterol. If you lower salt, moderate salt in the diet. Many young women may not be hypertensive, but already the American diet is very salty. So we're not saying eliminate it, but you don't have to oversalt. And I think people can go a long way if they get processed foods out of their diet, because that's
Right.
very key, right?
Yeah, for sure.
And
And I think exercise and sleep. I wanted to throw that in because I think when we're younger, you don't realize the importance of sleep. And I think if you can implement healthy sleeping habits at a younger age and continue to keep those, it has such an effect on your overall health. So I can't stress that enough for these younger women that are burning the candles on both ends, the importance of taking care of yourself and getting a good night's sleep.
That's right. I want to thank Anne for that question. It's a great question. So I really want women to check out your healthybreast.org. And or they can access that from healthywomen.org.
Correct.
I know we only have a few minutes left, but I know that you're working on some other practice, right? You're going to do a COVID-19 hub, or
COVID-19 will be part of the vaccine hub. So we're creating a whole vaccine hub. And the reason why we're doing this, it's so important because vaccines, again, across the lifespan. So the importance of, your newborn through, your toddlers and adolescents. And then for adults, again, bringing it back to us women, that 35 to 64-year-old, making sure that we're vaccinated, or, seeing if we need a booster. And then looking at, as we care for our aging relatives, making sure that they get the vaccines that they need, especially, so many older patient or people have some, chronic conditions that make them more susceptible. And with COVID-19, no better time to kind of create this hub to also include actual factual information on COVID-19 and making sure people have access to that and understand how they're delivering the COVID-19 vaccine, and making sure that when it is available for you, that you are getting that vaccine.
right. And we keep saying when it's available for you, but I think with the increase in vaccines approved and increased production, it will be easier for more people to get vaccines in the future.
I agree. I completely agree. And I have to say, I was very impressed with the way that the health system that I work at was rolling out the vaccines. It was very effective, and just very organized, which I appreciated.
All of my patients have been reporting back where they're getting their vaccines, and some of my patients in New Jersey have gotten their vaccine at the Meadowlands, and I had a patient who got their vaccine at Yankee Stadium, which is iconic and exciting, and also at the Javits Center and all centers throughout New York State. So I think when it's time for you to get your vaccine now, and as more people get vaccinated, I think it's a good idea to get the vaccine and to also still wear your mask.
Yes, continue to mask up. It's so important. This is not going to go away. It's another layer of protection, and we can't, I just think that's the important thing, washing hands and staying masked up.
That's right. So Beth Battaglino from Healthy Women, I want to thank you so much for joining us on Heart to Heart with Dr. Nieca.
I love it. Thank you so much, Dr. Goldberg. Have a great day.
I look forward to speaking with you again.
Me too. Thank you.